We need effective and efficient oversight of programs that are funded by state monies. The taxpayers deserve that. Unscrupulous recipients of funds should be found and prosecuted. The Office of Legislative Auditor received 67 requests for investigation for various programs this year. They have the staffing that allows for 5 investigations. Some of these requests are frivolous and politically motivated to make the other party look bad. Some of the investigations are like the 10-year debacle of the light rail, and the expansion of that is very complex. Leaders from both parties have begged lawmakers of their own party to refrain from overloading the Office of Legislative Audit with so many investigation requests. The OLA has a small staff. Either the legislature has to significantly beef up staffing in that office, or lawmakers need to exercise wisdom in making investigation requests.
Thank you. That's a really big one. Health and Human Services is our biggest issue at the Capitol. We have plenty of funding. The problem is the funding is not going to the right people. And we saw that in the CCAP program. So there's been a number of issues brought up on that. And I kind of like, there's one rep that has an interest in dividing up the Health and Human Services Department into 4 pieces to make it smaller and more manageable. I don't know the details on it yet, but I like the idea because we need to get a grasp on Health and Human Services. I think they're within $1 billion of being the biggest piece of the pie in our budget. So I'd really like to see more oversight, more accountability, and preferably divide up the Health and Human Services into 4 departments. One thing I've been working on for probably about 5 years now is a welfare reform bill, and not to impact people negatively, but give them an opportunity to succeed. And I was told about 2 years ago it couldn't be done, and then I got kind of put on the shelf for a while, but I talked to some revisers, and the revisers are the people that actually write the bills. And we've met 2 times now, and both of them, there's 2 revisers that are helping me, and they're on board. They think it can be done. I talked to Representative Schumacher, and he probably will be the chair of the Health and Human Services Committee. He loves the idea. So what it'll do is it'll set up people that are on welfare, allow them to work, and get some assistance for their health insurance and daycare costs, those type of things. But it'll be a 24-month program. It's a scalable one. So if you're a family of 3 is only making $35,000, they'll probably get all their benefits. If it is, if they get a raise or a new job and their wages go up to $45,000, then they'll be responsible for a part of the health insurance costs and daycare costs. I'm very excited about it. If we can get this done, I think it's going to take about a year to get it put together, and hopefully in 2024 session we can pass it, and it'll fundamentally change Minnesota from being a welfare friendly. We're one of the most friendly states for welfare in the country, and we're one of the highest tax states in the country. So you got people wanting to move in that don't want to work, and you have people that want to start jobs or start businesses and invest in the community that are moving out of the state. So I'm excited about the bill. This should really help Minnesota be profitable in the long term.